Hello, my name is Katie Gray, and I'm a pharmacy student at the Fisch College of Pharmacy at UT Tyler. And today I will be presenting to you your new medication, Albuterol. So what is Albuterol? Albuterol is going to be the generic name of some brand names you may have heard, which would be Ventolin, ProAir, ProAir Respaclick, Acuneb, Proventil, or Proventil HFA. These can be used as either an inhaler, so something like this, or as something that would be used in a nebulizer, like what you might see in a hospital, but you may have it at your home as well. So why are you taking this medication? It's very commonly used in asthma. So when you have acute symptoms like bad asthma attacks or an exacerbations. So when you're having attacks more often, you may need to use your inhaler more often. Also for exercise-induced asthma attacks as a preventative measure, you could have it if you have COPD. And in some rare cases, it is used for hyperkalemia, which means high blood potassium. So how should you use this medication? You should always follow your doctor's directions on how many puffs you need to take and how many times per day, as this may vary based on your condition. For asthma that is caused by exercise, I would recommend that you take 2 puffs 15 to 20, maybe 30 minutes before exercising. That way it will get into your system before you start playing or exercising. So what I want you to do right now for me is take your inhaler, if you have one like this, and check on the back. There should be a dose counter. And you want to look at this dose counter, and you're going to want to see how many are left. That'll tell you how close you are. Usually they start with 200 doses, and you may get down to like 198. That may be what you start with. Now, as you get lower and lower, that means you're getting close to being out. So you need to remember to order your refill. Also, I'm going to show you real quick some little tips on how I use my inhaler. So you're going to take off this cap, which always needs to stay on when you're not using it. Okay. If you haven't used it in a while, you go ahead and prime it, which is to say you're going to puff it away from your face. So point it away from you and click it twice. You're just getting rid of extra of the not medicine just to get it out of the inhaler. So that's if you haven't used it for a while. If you're using it every day, you don't have to worry about that. Okay, now what you're going to do is take a deep breath out for like about 5 seconds. Like once you've done that, hold up the medicine, hold it up to your mouth, this mouthpiece, and make sure you make a tight seal around it and take a deep breath for about 5 to 10 seconds, as long as you can, and try to pull the air deep into your chest, and then hold that in your chest as long as you can, about 5 to 10 seconds. Try to count, like even on your fingers, up to 5, and then go ahead and breathe out for the same amount of time. Just like breathe out slowly, like Okay, so you couldn't see my fingers, but I was counting out that I was breathing out for 5 seconds. Breathing in slowly and out slowly is going to help make sure that the medicine gets to stay on your lungs as long as possible. So that's going to help keep it nice and keep you medicated and keep making sure it's in where it belongs. When you're done, always remember to replace that cap and put it back in a cool, dry storage place. And we'll talk about storage again here in just a little bit. But that's the basic use of your inhaler. So if you miss a dose, you can take it as soon as you remember it. If it's within, an hour or so past your dose, if you have scheduled dosing. Now you can take any remaining doses in the day at evenly spaced intervals. So if you take a dose that's a couple hours late, then you don't want to take your next dose that was due, really soon, you might need to take that spaced out further. So if it was due in 4 hours, but you're now just 2 hours away from that dose, you could take another one in 4 hours if you're taking a dose every 4 hours, if that makes sense. We don't ever want to take 2 doses at the same time. If you're really close to your next dose, you should go ahead and wait until your next dose and take it then. And just don't take 2 doses at the same time, because that can increase risk of any kind of complications. So we don't want bad things to happen like that. The side effects that can occur that would be considered common are nausea, throat and sinus infections, throat irritation, upper respiratory tract infections, tremor, and nervousness. For the first few, like the infections, one way we can work to prevent those is by rinsing your mouth every time you take your inhaler, and when you use it, go ahead and once you finished using it, you can rinse your mouth out with some water or a drink and just spit that out, and that'll help just cleanse that from your throat. Okay, so what should you tell your healthcare provider before taking this medication? So these are some medicines that don't work very well or have interactions with your new albuterol inhaler. So you need to tell your doctor right away if they don't know that you're on these medications. It includes non-selective beta blockers. This could be propranolol, nadolol, timolol, pindolol. So a lot of the lols. It's not all of them. So you might be on something that's called a selective beta blocker, and that might not be a problem, but you do need to bring this up with your doctor when you see them. Also, things that could be a problem would be an MAOI, or a tricyclic antidepressant. So a common tricyclic would be amitriptyline. Also, you could be on digoxin or any of the diuretics. Any of these could interact with your new albuterol inhaler. So those are things you would want to talk with your doctor about. You need to talk to your doctor about how often you've been experiencing asthma attacks, and also if you've been hospitalized for any of your asthma exacerbations. So these bad asthma attacks recently, and how many times you've been hospitalized for these. Okay, so where should you store that medication? Something I was talking about earlier, we always make sure we get the cap back on the medicine when we finish using it. And we want to keep it in a cool and dry place, away from direct sunlight. Don't leave it in a hot car. I know we need to take it with us, but leaving it in a hot car could result in it messing up the medicine or even blowing up the little canister, since it's got pressure in there. You're going to avoid keeping it in the bathroom because that's going to be warm and wet. So we want dry and cool. One big tip is always keep that cap on the inhaler, and always wipe the mouthpiece of your inhaler after each use. This will prevent any kind of fuzz or just germs and things, crud building up on the outside, and that'll just help keep it as clean as possible. All right, I want to thank you for listening to my counseling video here. Again, I'm Katie Gray, and I'm a student pharmacist from the Ben and Maytee Fisch College of Pharmacy. Thank you.